You're listening to the Casual Swinger Podcast. As your hosts, we need to warn you that the material you're about to hear may be sexual or explicit in nature. This podcast is intended for an adult audience. Now, we don't expect you to act like adults. What's the fun in that?
We're a married couple living in Florida with over 13 years of experience in the lifestyle, and we take almost nothing seriously. Casual Swinger is a variety show, meaning we'll cover everything from music to events, travel, and even the occasional hilarious screw-up. Our show is about entertainment. We're not licensed professionals.
Not anything.
And our stories, commentary, and guidance should not be confused with the opinions of a licensed professional.
Now that you know, let's take those pants off and get comfy.
Oh, and hello there again, everybody. Both of you crazy, loyal, dedicated listeners out there.
They're so nice.
My name's Mickey, and this is the Casual Swinger Podcast.
And hi, I'm Mallory. I'm here to play along.
I like when you play.
Me too.
It's fun. You're dirty.
I can be. If you want me to be.
Get on that shit. No, literally. Hey, this is the breast episode ever. It's the breast episode we've ever done.
Yeah, and it's going to be a great episode.
All about them titties.
Mm-hmm, totally.
Jugs.
Mm-hmm. Honkers. Hooters. Mm-hmm.
Fun bags.
New hoots. Who dis?
Oh, yeah. Dude, I looked for a picture of owls to put in
like
the episode art.
A set of two?
Yeah, just like two owls standing next to each other because you keep going, new hoots, new hoots, new hoots, who dis? And I'm just going to have a couple of owls going, what? God damn it.
I think it's the funnest word. Funnest? Is that a word? Is that a word? It's a fun word to use to describe my boobs. I love hoots.
I'm so glad you do words. The
I
funnest.
I don't think funnest is a word, is it?
No, it's
okay.
really not.
Whoopsie.
All right, though. That's right. It is a really fun word. I love Hooters. I love
Yeah.
titties. I love fun bags. I have been a fan since I was a baby.
Me too.
Yeah.
What are the chances? So much we have in common. So
whose were the first titties you ever played with?
who's for the first titty? I mean, like for like sexual fun?
Uh-huh.
I'm not giving their name, but I was definitely in high school.
I thought you were going to say yours.
Yeah. Well, aside from mine, like, of course I did self-exploration, but yeah, I think I was a freshman or sophomore in high school.
Yeah.
Yeah.
I mean, is it like the whole like general like brush up against and rub thing, or do you like grab the nipples and twist?
It was actually very awkward because we're standing there shirtless and like, it just
Like,
kind
oh,
of
look, they're kind of like mine.
I
But
reach
different.
out and like just place a hand on it and let it sit and like, I don't think we're supposed
Put
to
a
do
hand
it
on
like
it,
that.
see how it feels.
Yeah. It was kind of funny.
All
We got the
right.
hang of it quickly though. Like we figured the shit out. It was just nerve wracking.
Well, we talked about your Mallory, that'd be you,
Me?
your breast augmentation back in the episode we did called Thanks for the Mammaries. But we had such a great experience with the doctor, we thought we'd have him back on and talk about some of the finer points of being a renowned plastic surgeon and maybe throw in like why Michael Jackson's fucking nose fell off.
The fact that he knew that made me love him even more.
Oh my
Which
God,
is
yeah.
incredible. I'm so excited to have him on the show today. And we even got a little competition going on for this episode. So if you go to his website, we'll tell you in the segment and in the show notes here, I believe it's drdavidplink.com, and figure out which new hoots belong to moi, Mallory. The first person to guess correctly wins either an Arcwave Ion for the guys or a Weavite Nova 2 for the girls. And you can choose to get one for your significant other, special human, whatever. But
Only giving away one.
just
or the
one,
other.
just
Yeah.
one. It has to be the first person, and this could be through email, social media. So best of luck to everyone guessing which ones are my hoots.
I feel like this is a softball, all right? I looked because he only put a few sets up there because he wanted people to have a shot at winning this thing.
I know.
And it's like, guys, you have like a 20% chance of getting it right out of the gate.
Yeah.
So,
So best of luck.
yeah. And I hope everybody likes all your tattoos.
Yeah.
So now I'm fucking with you guys now. You're like, wait, what?
That's
It's going to
so
be
funny.
awesome. It's going to be fun, but this is the best episode ever. We're going to get back to talking about titties here in a few, but before we do that, we got to talk about what's new. After all, this is the intro. This is where we talk about fun shit we're doing and I don't know. Each
Yeah,
other.
we have a lot going on. It's going to be a sexy, fun summer. Lots of travel in store for us. But
No, you had slutty as fuck summer last year and nothing happened.
that's not true. That's why I'm not saying anything.
Oh, okay.
I'm not jinxing it.
Okay.
All right? You with me?
All right, I'm with you.
So, yeah, it's going to be a packed summer. Something that's new that's going on that I'd love to talk about is a casual cocktail event that we have coming up.
I'm really excited about that.
Me too. I think it's going to be really awesome. This is a virtual event done at home. However, we're bringing a very entertaining bartender. The event is June 16th, 2022. This is going to be on a Thirsty Thursday. And we're going to teach you guys how to make 3 amazing cocktails that are whiskey-based. The only thing that doesn't come in the kit is alcohol, but you'll have everything you need to make 3 drinks for 2 people.
Yeah, and if for some reason you don't like whiskey, you can still do this. You can still come hang out with us, and you can still make the drinks with other spirits. There's actually, we're going to give you optional spirits, 2 or 3 different spirits you can use if you don't like whiskey.
And I believe there's a mocktail option, but I'll double check on that.
Yeah, so we're doing this for fun. We have an amazing, what I like to call, a bar median. Who's
that's
be
true.
Us, Amadeus.
Yeah, he's an improv comedian. Yes.
Yeah, he's kind of amazing. So, and it's a pajama party. So come dressed in PJs or lingerie and enter to win some more free toys.
I know.
From Casual Toys.
Yeah, this is going to be great.
I would thank Casual Toys, but that'd be a little self-serving since we're thanking ourselves. Doctor.
Mm-hmm.
Doctor.
Yeah, I got you.
Got it.
Yeah, but we're gonna party for a couple of hours. We're gonna laugh our asses off. And in this kit they get the casual cocktail cup.
Yeah, those. So I had some Chinese kids make us these cups. They're absolutely awesome. They do a really good job. They're really professional cup makers. So I got those. They came overseas. It took us like a month and a half to get them, which is why it took us a while to get these things off. But they're awesome. They're like Yeti cups, so they're really, really cool.
They're the short tumblers, insulated, really well done, black matte. They did a great job on them. They're fucking fantastic.
I'll use them again for sure.
100%. So anyone interested in attending the event, you can go to thecasualcocktail.com for details and to purchase your tickets.
That's right. Those tickets are $99. We're not making squat on that, guys. If it sounds like a lot, bar medians aren't cheap, and neither is all the stuff that comes in the boxes. So we're going to get all that stuff out to you. We're not making shit on this. What we're doing it for is to have a good time and hang out with you guys on a Thursday, because people keep asking us, hey, when's your next event? When's the next time you're going to do a thing? And honestly, with the new job and the grand spawn, all the stuff going on, we just haven't been able to book something in person. So we thought we'd get something on the books that you can do from the comfort of your own home. We'll ship you all the shit to do it with, except for the booze, like Mallory said. So make sure that you go out and pick up a bottle of whatever your favorites. And by the way, today we're going to do another Whiskey of the Month. So if you don't know what to put in these drinks and what to buy, stay tuned, folks, for the end of the episode. We'll tell you all about May's Whiskey of the Month.
I know. I'm super excited for that. And I promise I am definitely going to be wearing my PJs/lingerie for this event. So.
Whatever. You're going to take the hoots out for a walk.
I might. We'll see.
Yeah, it's going to be awesome. But hey, we also did something we haven't done this in years. We booked this, last week?
Yeah, you booked Nin, like out of nowhere. We're going to Naughty and Nawlins.
That's right. Going to Naughty and Nawlins, going to be crazy fun. I think really what inspired me to book Naughty and Nawlins this time is we were with Paige and Penn last episode in Tennessee. We were with Jay and Angie, and we're around all our friends, and we're so happy when we're around our friends, and they're all going to be at Nin. We have a bunch of other friends, obviously, that are going to be there. So we're like, you know what? Fuck it. We're booking it. So we did.
So FOMO got the best of you.
Yeah, I guess. Or just
no.
I just got harassed by our friends enough until I said yes. Because 2 or More to Tango, who we were just on their show.
Yeah, they're going. Kate's going. Yeah.
Kate's going to be there.
And there's a bunch of people we haven't seen in a long time that are going to be there as well. So I'm super excited. Thank you so much for doing that. I can't wait to go partying in with you. And anyone else going? Do we have anyone that we know that has a code for Nin that we want to share?
Oh yeah, Wanderlust.
There you go. There you go. So if anyone's interested in going to Naughty and Nawlins in July and meeting us there, feel free to use Kate's code Wanderlust.
Yeah, please do. It's going to be awesome. Hey, what are we doing this week? Literally 6 days from now, what are we doing?
Packing furiously and hoping I remembered everything for PCAP.
Right? Because we got so much shit to take to PCAP. It's crazy.
I am so fucking excited, though. I am shaking with excitement.
Well, so for PCAP, and we'll give people a little spoiler here, for PCAP, we're doing a session on videoing the moment, capturing your sexual activities.
Mm-hmm.
And I was like, I'm just going to sit down and write down some highlights because, we'll just kind of wing it and talk from the hip. And we'll just spend an hour showing these guys some of our favorite positions for photo and video sessions.
Well, that and the equipment, because we've found some gems and some duds in our experience because we do enjoy filming.
But what I like to do is give people something they can't get here on the show because they're paying money to go to this thing, right? So I want to give them something that kind of blows.
Oh, I get that. I was doing my stretches to make sure I was able to pose.
Oh hell yeah!
And hold it.
All right, Flying Lotus
kidding.
or whatever it is you're doing. But no, what I'm really getting at, though, is I sat down to do these highlights, and 11 pages of writing later, I'm like, maybe I went too far with this.
Yeah. Yeah, you got a lot of details in there. So I think we're going to have a partner to the track that we're doing. Is that what would you call it? A compliment to?
A complimentary piece, if you will.
So I think you're going to have a blog piece.
It'll be a hell of a long blog, but it'll be fun. But yeah, PCAP is days away. We can't wait for this. If you do find yourself available and you don't have any plans for June 3rd through 6th, come on out to Palm Springs. Use 10%. You get 10% of your room off if you use the code that we have. So we're going to cover 10% of your room if you use the code LOVETOYS.
Yep. Please do. There are rooms available for the code that we could only do up to 10 rooms. So
yeah, there's only 10 of those rooms available. So
yes. So we still have some rooms left. So if you have the time and want to come out, I know it's just a week away, but it's doable. So feel free to use that. That's Love Toys.
It's going to be redonk.
Yeah, Podcast-A-Palooza.com.
Yeah, see, that's I talk cool like that. You guys like that? That's when I bring up. See, we just had a high school graduation.
Choice.
All of his friends thought I was cool.
Yeah.
Because I talk like that.
Yeah.
Snap me later.
Yeah. They don't talk like that at all. It was your purple hair.
Oh.
And the fact that you embarrassed the kid, they thought it was pretty funny.
I did plant one on him in front of
you
all
gave
his
him a big
friends.
old wet kiss on the side of his cheek, and I was like, "Oh dear God, thank God he doesn't have to come face these guys on Monday." Like
that was fun.
No, we had a great time. It was awesome.
But anyway, we got one more thing coming up. You want to talk about Park City?
Yeah, this one's interesting. It's kind of vanilla. I'm not sure what we're going to get into, but I've never been to this part of the country, so I'm excited that we're going to be around Salt Lake City and the Park City, Utah area next month, end of June.
Yeah, end of June, which I've never really spent much time out there. I've been to Salt Lake once or twice. It's very conservative. I don't expect that we're going to have a lot of listeners in Salt Lake, but maybe we do.
Hey, give us a shout if you're in the Park City area or Salt Lake area. We'll be out there for the weekend before a conference.
Yeah.
So I don't know if there's any Mormon swingers out there.
Mormonswingermingle.com. Just check it out.
Maybe. But I'm excited. It's such a beautiful area. I've only seen it in pictures, so I'm looking forward to exploring and seeing what it has to offer.
I think I just discovered a market. Get your jollies. Let's be Polly. Come on, we can do this.
Oh my God.
No?
No. Don't.
Right.
No. Hallmark said no thanks. 2 out of 10 don't recommend.
But we're going to Park City. We're going to hang out. I'm going out there for a conference. We're going to be out there for a few days ahead of time. If you guys want to catch up, shoot the shit, find a bar in Park City and drink till 6 p.m. and then go to church, we can do that.
Okay.
Okay. No?
Maybe not.
All right. Not happening. Well, anyway, I tell you what, you guys want to get on with the show and hear from our good friend, Dr. David Plank.
I'm so excited.
Talk about dem titties.
Oh, he's amazing. I hope everyone loves him as much as I do because he changed my life legitimately for the better.
Yeah.
Love that guy.
Yeah, you have a spectacular set of hoots. I really love your
Well, and I just feel overall better about myself. I feel more confident in my skin and naked. That's the big thing.
It really did kick off a bit of a renaissance for you.
A little bit,
You work out 6 days a week now, and you always looked good before, but you were never like this monster in the gym like you are now, and you're just always active, and you look fucking fantastic.
I love you so much. I hope I don't regret you saying that because people are going to have this expectation that I'm totally ripped or something because I spent 6 days in the gym. No, I just have a horrible metabolism, and I'm trying to do my best here.
Well, you're killing it. I'm proud of you.
Thank you, baby.
Anyway, on with the show. Let's get out of here and come back in a minute with Dr. David Plank, but not before Mallory does the thing.
The thing. I guess we have to tell everybody who we are and where we are. So we're a Casual Swinger everywhere. That's casualswinger.com if you want to check us out there. You can reach out to us at podcast@casualswinger.com. We are on social media. That is Twitter, YouTube, Facebook, and Instagram. And if you want to check us out on the dating sites, it's Double Date Nation, SDC, SLS, and Cassidy.
Uh-oh, that's all the things.
Yeah, that's all she wrote.
All right, hang in there, folks. We'll be back in just a hot second with Dr. David Plank.
Yeah, let's play with some boobies.
We're having some fun on the best breast episode ever. Not best, but breast episode ever. You've been listening to Casual Swinger.
And you're back with Casual Swinger. I'm your co-host, Mallory.
And I'm still Mickey. I'm not that guy this time. I've been that guy for the last 2 episodes. So.
Well, welcome back. I missed you very much so. I'm very excited about our guest today. How about you?
Oh, I couldn't be more excited if I tried. We've been trying to book this fucker since you got new tits.
It's true. I think this is the best personal investment we've ever made in me.
Right? Well,
Yeah,
couldn't figure out if we were going to call this episode New Hoots, Who Dis, or the breast episode
That was
ever.
basically my running joke for the first 6 months that I had my boobs.
Yeah, that's absolutely fantastic. But hey, we've got a special guest on the horn with us right now. He doesn't have a ton of time, so we're going to get past all the pleasantries and introduce the amazing, and I think he's amazing because I love my new toys. The only thing he didn't do that I wish he had was put squeaky toys in them.
Negative Ghost Rider.
Oh, come on. It would have been fun. But his name is Dr. Plank. He is an esteemed plastic surgeon here in the Orlando area. Dr. David Plank, how are you today?
Fabulous. Thank you so much for having me. Yeah, it's been a long time coming, hasn't it?
It really has.
Yeah.
I mean, I wasn't once she got him. It was a fast time coming, but we're talking about two different things, aren't we?
It's a good Christmas present.
It was. It was like having a new girlfriend, which, is less common more common for swingers than it is for maybe other people.
Mickey, they're up here. My face is up here.
Yeah, right. Hey, it's not a bad life. I'm pretty happy with the results here, and especially, the symptoms that come along with it, especially the good ones, like you said.
Oh, yeah. It's been an absolute blast. But so this is the best episode ever. We're going to talk a little bit about you, but we really want to talk about your approach. Like we said in the lead-in, one of our favorite things about working with you was, frankly, you were human.
Yes.
And humanity in the medical profession is fucking hard to come by anymore. And you really made us feel like you were looking to help and actually serve Mallory's needs, which was a big deal to us.
Yeah, your differentiator for me was that we were having conversations, which was bidirectional versus a dictation. Something that I experienced when doing my research and doing visits where this is what I do, this is how I do it, and take it or leave it. And I found that really cold and not serving everyone's needs. It sounded like factory work.
Yeah, very much so. So let's start with the basics, Doc.
Sure.
What's the name of your practice? What is your specialty? And what are your certifications? Give us the short version of your very extensive resume. I read all that shit on the wall. Just give us the high notes.
Yeah. So, again, my name is Dr. David Plank. I'm a board-certified plastic surgeon and went through 6 years of plastic surgery training to do what I do. Learned all the techniques of cosmetic surgery. My practice is Mid-Florida Dermatology and Plastic Surgery here in Altamont Springs. I do go to other offices, Oviedo, Claremont. When you call my office, we can find you a closer office to see me. And, that's basically what I do, cosmetic plastic surgery.
Awesome. And how long have you been doing that?
I graduated in 2013 from University of South Florida, and I haven't left. I just love Florida so much. So about 9 years, coming up on 9 years. And then shortly after I graduated, I did, you have to go through board certification, which takes about 1.5 years to do. So I'm board certified in 2015. So, it's a long, arduous, and very expensive process to become a board-certified plastic surgeon.
Yeah, that's dedication and commitment for sure.
Yeah.
Well, and I would have to think that Florida, California, coastal Texas, those are probably the hot spots for plastic surgery because everyone's got their tits out.
That is true. One of the things, I grew up in Ohio, very, very modest state, and I loved Florida because a lot more skin was shown, and when you training in plastic surgery in Florida, you have to understand the techniques. You have to understand what people want and how they want to look in a bikini or even naked. That's for sure. But I love Florida. I love the temperature. Definitely, temperatures rise, clothes fall off, as you probably know in these coastal regions. California for sure, but I grew up in Ohio, a lot of sweaters, so you don't get to see a whole lot of skin. So it's kind of like a surprise if you're hanging out with some people.
Yeah, sweater puppies aren't half as much fun when they're covered with a sweater.
That's right.
So I've been a fan of boobs since I was a baby, personally. It's just been a thing, and I think most guys are probably wired that way. But what made you choose this field of medicine, and why in the hell? I mean, were you fascinated with Play-Doh, Legos? What was your deal, man?
Yeah, well, my dad was a mechanical engineer, so I was always told to, hand him tools, things like that, fix things, and then kind of an engineering mindset. So fixing things, make things better than the original. I originally wanted to go into cardiology, but when I got to med school, I found plastic surgery was very diverse, and And then usually the plastic surgeons I hung out with were more fun than other doctors I found. Certain specialties attract certain personalities, but some of the plastic surgeons are more fun. And the opportunities to help somebody individually on an immediate basis, that's what was the sexy part about becoming a plastic surgeon, is that you do a facelift, boom, huge improvement, breast implants, breast augmentation, and immediate improvement right away. And you can see the results right away, and the patient's extremely happy with the results. So that was the main reason for going into plastic surgery, for sure, for me. I love it every day. Every day is different. And I think most people that love their job, every day is different. So the challenge of not knowing what's going to come through your door every day in the clinic or what kind of surgery you have to do is the most attractive part of being a plastic surgeon.
Yeah, so I just got to imagine what a proctologist with a personality would be like. I mean, it's probably unlikely, but when it happens, like, you're looking at my butthole, let's go ahead and have a fun conversation.
Would you expect them to be an asshole? Is that what you're saying?
Well, they should be. Proctologists should be assholes. That makes perfect sense.
You're so weird.
Yeah, there's like that old Seinfeld episode, right? Ass Man. That was that was the best episode ever.
I have to go back and look at it. Seinfeld, for when in its heyday, was way too smart for me. I wasn't quite there yet to catch all the jokes. But I love that you chose a profession that gives you a certain level of gratification and compassion for people, and I absolutely love that. Something that we didn't touch on, just to talk about you just a little bit more, is you work with the local university, UCF, University of Central Florida. Can you tell us a little bit about that work? And because I've shown a few of your residents my boobs already, so
I think like 20 of them.
Yeah.
Yeah, some of them keep coming back. They keep forgetting what they look like. That's for sure. So I'm the director of plastic surgery there. I started as an assistant professor there when I was originally working at the VA down in Lake Nona, and then became an assistant professor, and then slowly kind of evolved. And I love teaching, so I have the medical students come and rotate with me, and the residents from other hospitals come and rotate with me to learn a little bit more about plastic surgery. So that's my involvement with the university. They invite me to give talks. I'm in charge of the medical students that are interested in plastic surgery from medical school to residency. So they come and seek advice, and I write recommendations for them on a national level. So far, I've been fairly lucky with these medical students. Are so smart these days. I've had this past year, I had 2 medical students that went on into plastic surgery residency, which is the most difficult residency to get into per. So the number of residents or medical students that apply, the percent of acceptance is very low. So I'm very proud that these medical students are able to come to my office. I'm able to help them and kind of springboard them into a life of a great career in plastic surgery.
Yeah, I will say every one of them that I ran into in your office were incredible. Even telling our story or catching on our stories, because we love to shoot the shit with you when we came in for the appointments. And I was a little concerned that we'd rock them back in their heels or shock them a little bit. And everyone just kind of rolled with it too. And you can see like them digesting. And I could tell when they left the room which ones had questions for you as a follow-up too. Like probably more medical, or maybe it was, hey, these freaking weirdos that were just sitting there. What's up with them?
I love to teach medical students real life experience that they're not going to find in a textbook. So there's certain things they teach them, proper care for patients. But I think with plastic surgery, it's such laterality to it, because you're dealing with, it's very intimate with a lot of patients, breast augmentation, facelift, things like that. So you break the ice with the patients, and it's nice for medical students to see physicians have an approach that I do. Very open-minded, very loose with the patients, and it makes the patients more comfortable because I've had a lot of crazy jobs in the past, and I've learned how to talk to all kinds of people. So I think that experience in my past has helped me currently in as a plastic surgeon to kind of roll with it. No matter who walks through the door, I can find a way to crack a smile on somebody's face with just a conversation, for sure. But the medical students for sure learn a lot just from the non-textbook reality as to what it is to be a doctor.
Did you tell these guys before we got there, all right, beware, these guys are crazy swingers and they're really out there and her tits are probably going to be out in the lobby? And
No, I like to shock them because I'll say something crazy. And then I like to look at their face to see what they have to say, just by their facial expression for sure. I love it.
awesome.
Yeah, most of them tried to be very, very professional, and I love that. Like that, it made me feel at ease, but it was also a little funny, if I'm being perfectly honest.
Yeah, I do that on purpose as well, just to shock and awe them because, I don't really grade them. I have no control over their lives. They're just here to learn, and so being off the wall is certainly an educational experience for them. So they try to remain within the guides, like within their stay in their lane based on how they're guided at their institution, at the hospital, whatever. But I think and then the second time they come in, they're actually or the more times they visit, they're more relaxed for sure. They open up a little bit more and they tell me more stories on their end. Then they get a little bit more open-minded about certain questions about certain things, what I do on certain patients and things like that. So they certainly open up more after actually patients like you guys, since you're so fun, they kind of loosen up a little bit more.
Oh, that's awesome. Hey, speaking of showing people my boobs, I think we're going to play a little game, aren't we?
Oh, I like playing games with your boobs.
Yeah, well, I do too.
Bongos, bury my face,
Motorboat.
blindfold.
Yeah, motorboat's probably your favorite.
Motorboat.
So I think what we're going to do for our listeners out there is Dr. Plank just upgraded his website, and I have my before and after pictures on there, to my understanding. So if you can identify my before and after pictures, I think we're going to give away what, Mickey?
Well, I think what we decided we were going to give away was, I think, either an arc wave or a womanizer.
Okay, depending on who it is.
Yeah, if it's a guy or a girl that guesses your titties,
yep,
then we'll give away a womanizer, or we'll do the new Joy from Arcwave, which is a masturbator with 8 different size settings.
Ooh, fancy. Just in time for Father's Day, too.
That's right. If you're a father and don't want to be one again, masturbate more.
So how long do they have to guess?
We'll go through the end of the month.
Okay, so May 31st is your last opportunity to guess.
Yeah. Well, actually, and I tell you what, we'll do the end of June.
Okay.
If nobody guesses by the end of June, we'll just guess that no one can figure out.
Okay, so that's June 30th. I had to sing the song in my head. 30 days has September, April, June.
Because this episode's not going to come out for another 2 weeks.
That's true. So June 30th, last day to
guess them titties.
Guess them titties. I'm thinking we'll probably get some in the first 10 days.
We usually get it by 6 a.m. the day after it comes out.
But yeah, so Dr. Plank, what is your website so people can go there and look at before and after pictures to take their guess?
Yes, ma'am. It's drdavidplank.com. It's drdavidplank.com.
Easy peasy. And
all one word. Yeah.
All right, we'll put that in the show notes as well and on Twitter when we launch the episode for everyone to play along.
Absolutely. So, Mallory, I think this is probably a good time for you to talk about your journey with Dr. Plank and kind of what brought us to Dr. Plank. And I know we talked about a little bit in our last episode about your journey, but just give people maybe a short version of it if they didn't catch that episode.
I'll give a little summary. So I always liked my boobs. I grew them myself from scratch, and I was very accustomed to having them. But I always felt like there was room for improvement. And this is a journey I went on that lasted about 10 years, right? When I made the decision to go get, additional consults. I had gotten consults maybe like 6 or 7 years prior. Just the timing wasn't right. The doctors weren't right. My mental state wasn't right. And I felt like this was the time. And I went into it with a scout mentality going, I have an idea of what I would like to happen and what my results I would like to be. And if that's not achievable, I'm absolutely fine not doing this. But I want to, if it's possible. And in my journey, looking for the right doctor, seeing if these results were reasonable, I did stumble across, a few obstacles and additional, questions that I had, because it seemed like everyone that I had talked to a certain degree had a very cookie cutter methodology, like a one size fits all. And at that particular point, I went, you know what, this isn't for me. I feel like this should be a very personalized journey. And I look around and I see naked women a lot. We're swingers. We go on naked vacations. We're in naked resorts and naked hotels. And women are so different, so versatile. How is this a one size fits all? And turns out it's not. And after meeting, Dr. Plank, he really opened our eyes into the possibility of, yes, I believe I can achieve your goal, and here's how. And it's the first conversation I ever had about it, and it's so impactful how much that meant to me in my journey. Even if I made the decision not to do it, I'll never forget that conversation.
Yeah, it was really weird, right? Because I remember we went to see 3 or 4 doctors, and it was a lot like the Shady Hills booby farm, right? Like everyone was the same, and they're like, "This is exactly how we do it. All titties come out exactly the same, whether you're big, tall, fat, small, skinny, doesn't matter. Your tits are going to look just like this."
There were only slight differences, maybe the incision points, right?
Yeah, and so that's definitely a fact. And then there was the machine that Dr. Plank used to show us what you were going to look like.
Yes, and he's the only one. I think we saw a total of 6 or 7 doctors.
Yeah.
He was the only one that had that kind of technology.
Yeah.
They
So
gave
Dr.
me a
Plank, what is
visual.
that machine?
The machine that Mallory's talking about is the Vectra, and it's interesting technology. It takes a photo of your body or face, but in Mallory's case, we took photos of her breast, and it has 6 cameras that triangulate on the breast, and it can reconstruct in 3D form the individual's breast, and then with the software system, you can add implants, and you can see what you look like after surgery in a simulated form. So you can do a side-by-side before the surgery, and then in a basically augmented reality, so to speak, of what your breast would look like after surgery. And you can vary the size of the implants, so you can have an exact image of what you're going to look like after surgery. And it's been very valuable in my practice because, you look on before and after photos, and individuals see other people's breasts, and everybody's breasts are different. With this Vectra, it's very individualized, so you can see what you're going to look like after surgery, and it certainly adds a lot of value and makes people more comfortable going into surgery because they have a mental image. They take photos of themselves, they take it home to their partner, and they look at it, and they come back and make a proper and well-informed decision.
Yeah, you hit the nail on the head. I felt much more confident in my decision after we did the Vectra, because what I was doing, and I was looking at before and after pictures, trying to see, well, do my boobs look like hers, and could they look like the after picture? So I'm trying to align myself. Do I look like the before, and will it look like the after, and what are the different methodologies? And it's so hard because that person could be 4'11" and I'm 5'5", so no, that could impact the size, shape, fill method. I mean, so many other factors, and I just got so overwhelmed. And the Vectra kind of quieted all the mental chatter and gave me something real and tangible to look at. So that was super beneficial.
So too, and I think the other thing that happened with Dr. Plank is your fear level was really allayed by just number one, the way he is, but then the other thing was, what you were trying to accomplish was what he was addressing, where the other doctors said, this is the only way to do it to avoid the dreaded capsular contracture, right? Yeah. And if you do it any other way, you have a 900% chance of having capsular contracture. It was like some stupid number. It wasn't 900%.
And everyone's percentage was different. Like no one agreed on what the risk rate actually is.
I don't know if you know this or not, but 88% of statistics are made up.
Say what?
Including that one. So no, Doc, I mean, that's kind of brings us to another conversation here. So Mallory's breast augmentation was over the muscle, subglandular. Which was kind of what she wanted because she was just trying to replace breast tissue that, was there and now it's not. So she just wanted to fill them back up, right? Put air back in the bones.
Yeah, I had to have a natural composition to them, too.
And so it made sense to us logically that this would be a good idea, yet everybody else kept saying, no, it's got to go under the muscle. I'm like, then what happens to the fun bag that's over the muscle because it's not filling back up? And no one could really answer us. You had a different approach. And you have taken over the practice for a gentleman by the name of Dr. Baker, who did a friend of ours' breasts, and they're fantastic as well. So we're like, this seems like the place to go. This seems like the way to go. Can you tell us a little bit about like how many women qualify for subglandular installation or augmentation? And I mean, can they all expect a result like Mallory got?
Yes, I think most women do qualify for subglandular placement for breast implants. It depends on how much residual breast tissue they have. So there's a test, it's called the pinch test. It's the upper pole, it's above the nipple. That area above the nipple is called the upper pole of the breast. And you pinch, and there's a significant amount of tissue there, 2 centimeters or more, then you qualify for subglandular implant placement. Anything lower than that, you're looking at 2 centimeters or less, then that individual would probably need a submuscular implant placement, which you're probably talking about before, what you alluded to when you're talking about other surgeons do one particular way. So that's the two methods for breast implant placement: above the muscle or below the muscle. And the muscle is the pectoralis major muscle. And but most women I see qualify for above the muscle. And I particularly like this method that was taught by Dr. Jim Baker, who actually developed the Baker classification of capsular contracture. So he's the godfather of that. He developed that over the years. And so he was my mentor for about 12 years, even during residency. And I was fortunate enough to work with him as a colleague and partner before he retired. So I learned all this technique, and I saw all of his patients, and they all had longitudinally excellent results. So, and I like that method as well, particularly for most of the women, because it feels more natural. Some of the side effects for under the muscle is what they call animation deformity, where the pec major muscle is over the implant, and every time you activate your pec major muscle, it'll move that implant more lateral. And there's plenty of Christmas videos I've seen of women juggling their jugs to Christmas tunes, jingle bells, because the implants are under the muscle. So yeah, that's always a treat every year. But those are the two methods. But what I chose on Mallory was above the muscle. She qualified. She had enough breast tissue, even though she did have some atrophy from the years, but she turned out well.
Yeah,
I'd like to think so. I mean, you've seen before and after pictures of my wife. My wife is way hotter than me. I think we can both agree on that, right, Dr. Plank?
I agree.
Yeah, and I think they came out sensationally.
Yeah, I have to admit it's hard for me not to show everyone my boobs, and I need to remember not to do it in inappropriate places like the grocery store, because that's not okay. So with my procedure, you did an incision that was effectively underneath my breast, kind of in the fold. And, in my research, obviously I was looking at, incision types that correlate with implant types. What is that called, and why is that placement important, or incision important?
Right. So I do the inframemory fold incision. One, it's easier access to get under the breast tissue to make the pocket to put the implant. And so that's the first incision. The second incision that you could do is the periareolar incision. That's just kind of cutting around the areola of the nipple there, and making a tunnel, and then making a pocket through that way. And then the third is transaxillary, where you go from the armpit down. And usually that's significantly more difficult to perform. You need other instrumentation, surgical equipment to do that. And that came and went. They talked about that as a non-scar, or the scarless incision, but it's still a scar on the armpit. But I think over the years, that has gone by the wayside. The more prominent ones are the periareolar incision and the inframemory fold incision. But I choose the inframemory fold incision because it's hidden. So once you make the incision, put the implants in, the breast drop to a more natural ptotic position, more natural position. So that incision's hidden, whether you're in a bikini or whether you're naked.
Yeah, I think the only time they're even visible is when I'm laying on my back and I'm
Your legs are in the air.
Yeah, and even then, like, my scarring's very, very minimal for being about, 9 months post-op.
Yeah, it's not bad.
Like, it's not bad at all. And I'm hypercritical. Like, I could find a stretch mark, from outer space on my body if I needed to. Like, I could totally do that. So for me to say they're irrelevant to me, I actually mean it. It's the scarring is almost nothing at this point. I'm very, very happy with that. So with the method that you use with me, is that something that you consistently use with your clientele, or do you use other methods depending on the patient?
I exclusively use the inframemory fold incision just because I have good, consistent results. There is some literature out there that shows that particular incision reduces the incidence of capsular contracture. The periareolar incision has a little higher incidence of capsular contracture, but the inframammary fold incision, it's a little easier to place the implant because you're already below and underneath the breast tissue. And I use what they call a Keller funnel. It looks like a little,
Was that like a piping bag?
Yes, a piping bag.
Yeah.
Yes. And so I use that. So that's how the incision's so small. So you can easily just deliver the implant into the pocket that was developed easily, and a touchless method. So it makes it a lot easier to do the implant placement.
It's trippy. I think you had a short video on your Instagram, maybe, or your Twitter.
Yes.
It was so trippy to watch, and I'm glad I watched it after I got my boobs. But it's super neat.
So they squirt it in like cake icing?
Kind of, yeah. It's fascinating.
So I shouldn't feel bad about squeezing those puppies.
Yeah, and
then.
for someone like you who's like, you get a little woozy about surgery, like there's really nothing, there's not a lot of blood or anything. It's just like all of a sudden there's no boob and then there's a boob, and it literally looks like piping bag.
No shit.
Crazy.
That's cool. Well, so there's another scar that we've seen fairly commonly, Doc, and that's the anchor scar that's associated with a breast lift. So what would necessitate a woman getting a lift, and what types are there, and in what scenarios would you perform each type of lift? I mean, is the lift predicated on where you put the implant, whether it's above the muscle or below the muscle, that kind of thing? Fill us in.
So the breast lift. So I always have women when they come in and they ask if they need a reduction or if they need a lift, and I tell them to go home and look in the mirror and just lift their breast up. If they like the volume of their breast, then they just need a lift. If they want more fullness to the breast, then I would do a lift plus an implant. So with the anchor incision you're talking about, it depends how much ptosis a woman's breast has over the years. A lot of women do a lot of breastfeeding, so over the time you have what they call breast atrophy and extra skin. It's like rocks and socks. So if those women want a lift and they just like the volume, then I would use an anchor incision, because that's the only way to really lift the breast and remove the extra tissue. And the incision itself is exactly the same with the anchor incision. I always put the implant on top of the muscle for those particular patients as well, if they wish to have a breast augmentation with the lift. So kind of the same procedure, implants on top of the muscle, and then breast lift for them. Sometimes you can do a periareolar mastopexy. So you make a donut around the areola and kind of cinch it like a purse string. But very few women qualify for that. They have to have a pretty smaller breast with a mild amount of ptosis, and then you can kind of cinch it up like a purse string.
Fascinating.
Drawstring titties. You heard it first here on Casual Swinger, folks.
So in my journey, I mentioned that, a lot of plastic surgeons had a specific methodology. They go submuscular, and most of them wanted to do a lift on me with that said anchor scar. Why do you feel that they choose that exclusive cookie cutter type? Because they seem so damn convinced, or at least tried to convince us, that it was the only way to go. So what's the psychology behind that, or the method behind that for them?
There are some techniques that has been in literature where it do some measurements, like the nipple to inframammary fold distance, and there's been literature out there say if you're over 9 centimeters, then you need a lift. But for me, I always listen to the patient. A lot of times women don't want the incision at all. They don't want the anchor incision all for the lift. But what I do provide for patients is if they want augmentation, usually you get a lift anyway with the implants themselves. There's high profile implants, which I use on you, Mallory, which provide that lift, and it avoids having to do further incisions to get a mastopexy or breast lift incisions. I think some of those plastic surgeons have a certain technique that they have consistent results and they feel comfortable with those results. And I think that's why you have some of the plastic surgeons that have a certain technique and a certain way to do it. There's nothing wrong with that for them. But in my practice, I always listen to patients and listen to what they have to say and what they want to do. Certainly you could do the implants, and then I always tell patients down the road, if you want to lift, we can do the lift. But I would say 99% of the patients, I convince them just to do the implants. They're happy and they don't want to lift.
Yeah. Yeah, absolutely. And that's kind of where I was, because again, we're naked a lot. So the scarring was an important factor for me, and the opportunity for, maybe a reduction in sensitivity, which was a fear I have, irrational or not, that with the lift getting so close to that nerve bundle underneath my nipple, I love them. I love how, their sensitivity levels. I didn't want to ruin that either. And I'd rather, if that was something that was a have to have in order to achieve the results I wanted, again, I was willing to forego it. But you gave me the opportunity to go, hey, we can do A, B, and C, and down the road, if that changes, then you can do that as an option later, if that's what you choose to do. But I think we can get there through this. And I mean, I almost had to pinch myself. I'm like, is this real?
Yeah, right.
I might actually get what I want out of this. This is awesome.
Well, at that point, I think we were actually leaning toward bailing on the idea, because you said, if I can't have what I want, I'm just going to do nothing.
Yeah, exactly.
And it seemed like, some of these doctors, I wouldn't recommend them to mow my lawn. And I think, we came out of this feeling so positively about you, Dr. Plank, that it was like, finally, we found somebody that gets it, that listens and says either that's a good idea or that's a bad idea. And not, that's a bad idea, end of discussion, we're not talking about it anymore. By the way, I'm done here. Have a nice day. Thanks for coming in. Give me my $100. Right. And that was not awesome. But there are complications. It's not all sunshine and rainbows here. And I know we're talking about how great Mallory's fun bags are. That's fantastic. I love that you have this catalog of colossal coconuts on your website. That's so cool. But at the end of the day, what are the complications that can arise from this? And are any of them severe? Who would be at risk? Who's a person that you'd look at them and go, I am not touching them teddies?
Some of the patients that I screen, basically, it has to do with comorbidities. Every patient gets a what they call a Caprini score, and it looks at basically the health of the patient, how stable they are for surgery. So if they reach a certain number in this Caprini score, they're not candidates for surgery. I mean, this is cosmetic surgery is elective surgery. It's not life-threatening. So I use that as a measure to protect the patient for potential complications down the road. But aside from that, some of the complications from healthy patients that undergo breast augmentation is infection, hematoma, which is bleeding in the breast pocket. Capsule contracture is another issue down the road. But those are the three major ones. I think hematoma is probably the most problematic, because after about 2 weeks, women feel good, they look good, and things happen at 2 a.m. that causes bleeding. So,
gee, I wonder what that could be.
Yeah. So those are the major issues. But typically, post-operative care for these patients, I give them antibiotics, I give them steroids, I give them Singulair, to mitigate any of those complications. And I follow patients fairly closely. I tell you 2 or 3 times within the first week after surgery, just to mitigate any of those problems, because most of the problems happen with about 2 weeks of surgery. So having the patients see me frequently, and also you guys had access to me 24 hours a day with my cell phone. So I think that puts a lot of ease with patients, and then mitigates a lot of problems as well. So if you catch it early, you can take care of it early.
Yeah, that was something I was actually going to bring up, that I don't remember the last time that a doctor said, this is my personal cell phone, use it anytime, day or night, that I wasn't friends with, that we hadn't, kicked off a friendship with. And I mean, we get there with a lot of the medical professionals we work with, partially because of the show, because when we have good experiences, we do bring them on and talk about it. Dr. Phillips is a good example. Andrea Lilavoy is another good example. So we've got all these, great doctors we're friends with, but you did that. You didn't know us from Adam. I was like, wow, that's impressive.
Yeah, and that definitely put my mind at ease, because, I mean, it is an elective surgery. I have a nursing background. So, I'm running the numbers in my head. I'm like, this does come with, risks involved. And, there's a lot of things that could potentially happen after this. And what's my investment? And is that risk reward factor going to be, for me? And having access and the proactivity post-op was really, really important. And yeah, I absolutely love that.
Yeah, it's pretty awesome.
All right, maybe let's switch gears for a minute and talk about swingers in particular, if that's okay. As you know, a couple in ethical non-monogamous relationship, we tend to kind of be naked a lot. You know, we go to parties, we're at clubs, we're with friends, we go to the beach. You know, not every procedure or method works for everyone, especially if their goal is to look good naked, like my goal was, right? Are there differences with how you perform certain procedures, cosmetically in general, when someone wants to look good in their clothes versus looking good naked? Does that come up often in your practice?
Yeah, absolutely. I try to every surgery that I do, I try to mitigate or minimize the scars that are present based on how they look naked. Because when I see them post-operatively, or when they come to me for an evaluation, they just want to look better naked, you know. And then if you look good naked, you're going to look good in your clothes as well, because it kind of follows that lead. So certainly hiding the scars under the intramammary fold for breast augmentations, tummy tucks, you know, I mitigate that by minimizing the amount of scarring, my incisions. And if there's anything down the road that the patient is unhappy about with some of the incisions that I made, I have lasers in the office that I can easily smudge out, like a little Photoshop finger. Remember the little Photoshop fingers kind of smudge out those lines. But I have patients wait about 3 months, let them heal by themselves, and if there's a certain concern area, I can just easily laser and just kind of make the incision disappear.
That's crazy.
So awesome.
We have come so far in the medical profession. It's just nuts. So we have a friend down in South Florida. She was a good-looking woman prior to plastic surgery, but she went through a divorce, sold her house, got a little money, and decided to get a mommy makeover. And now she's an exotic dancer in Tampa. So it's changed her life completely. And she is like the poster girl for mommy makeover. Tell us what a mommy makeover is, how common it is, who's a good candidate for it, and what can they expect? What sort of things go into that package of services?
So what's considered the mommy makeover is a breast augmentation with or without a breast lift and a tummy tuck. So you're looking at postpartum women that usually have a couple of children, and you know, having children does take a toll on the woman's body. So they get the breast atrophy. Sometimes they have extra skin, not necessarily fat, but extra skin from the child. And so they just want to kind of remove the extra skin from the tummy and enhance their breast. So that's the combo for the mommy makeover: breast lift with or breast augmentation with breast lift, and a tummy tuck. And typically these are women that have already had children. They don't need more children, and you know, the kids are a little bit older. I would say 3 or 4 or 5 years old, and they're going off to, you know, kindergarten or school, so they don't really have to stay at home with them, or they have more time on their hands, so they want to take time for themselves, really. So they come in and then see the consult, and I tell them, you know, what the whole process takes. And typically for these individuals that require the mommy makeover, breast augmentation with or without lift, and then tummy tuck or abdominoplasty, as we call it, with liposuction. Typically those patients that do those combination cases, I have them stay in the hospital for safety reasons, have an ICU nurse. They have a VIP section at the hospital that they have VIP care that takes care of them, make sure the pain's under control. But typically they're a lot of women that are mainly healthy. They want to stay healthy. They're fit, but there's extra skin that they just can't get rid of. And that's the classic patient that usually gets the mommy makeover.
Yeah, it's something I've heard a lot, being, you know, a mom myself, as far as like plastic surgery goes, and people I know that have had those types of procedures. Are there any trends in what you're seeing in consults and the types of surgeries that people are asking? Like, is there anything changing in the field? Is breast aug still one of the most common? Is it the most common? What are you seeing?
Well, so everybody's heard of the Brazilian butt lift, where you take the fat from the belly and then inject it into the buttock area to enhance the buttock area. So for that, they've adapted it to the breast. So they take the fat and inject it in specific areas of the breast to enhance the breast. And it actually has fairly decent results. Sometimes with those individuals with breast or fat grafting to the breast, typically it may take 1 or 2 treatments, just because the fat itself gets reabsorbed. About 50% gets reabsorbed over time. So you may need a little touch up, but it certainly has a nice natural look. And so that's been kind of an enhanced scene for breast augmentation or breast enhancement, really. It's safe. It's your own tissue. The only downside for that is sometimes you may get some fat necrosis, little lumps and bumps, but typically on mammograms for women, the radiologist can determine whether or not it's good or bad. And if that's a concern, then they would go get a breast biopsy from a breast surgeon. But that's the newer trend, I would say, for breast enhancement, using their own fat. It's not very common, though, because most women that need breast implants don't have enough fat to put in their breasts, really.
I was just thinking
breast
that.
augmentation is the way to go. Yeah.
Yeah. Wow. That's crazy. And yeah, I heard of Brazilian butt lifts. You know, personally, I'm doing squats because I feel like I have enough junk in my trunk. Right. So I think I'm okay there.
Is that where all these shelf asses are coming from? Like these giant asses that seem to come out of nowhere? I mean, when I was growing up in high school, asses were not 3 times larger than the person they're on, but now they are. Is that how it's happening?
Yeah, it's very trending right now. I don't know when it started. Initially, it was for just improving contour. Then you're talking about 100, 200 cc's of fat on each side. So a can of Coke is about 355 cc's, so you can put that mentally. So you're looking, 300 cc's on each side enhancement. Now, some of these patients are getting like 1,000 milliliters, 1,000 cc's, 1,500 cc's on each side. So that's your shelf.
So 2-liter soda bottles on their ass cheeks.
Yeah. And for me, I was seeing a lot of younger women getting nose jobs, like as far as trending. And when I was researching plastic surgery, at least that's the perception I had. So I was just wondering if that's kind of like what this influencer generation or the younger generation's considering versus breast aug. Have you been seeing a lot of that as well?
Yeah, the social media has reshaped how plastic surgeons have to approach patients because, as you know, filters with social media is all out there. So what you see on social media when you meet the real person, it's completely different. So it does distort what goals are that patients want versus what can actually be achieved. I think you've probably seen on Instagram where the new trend now is that they'll show one side, half of the image or the video will be a filter and the other half would be unfiltered. And it's like 2 different people, So certainly you have to approach those individuals and patients carefully because you have to understand what their expectations are. I have people show me what they want to look like afterwards. And sometimes it's just unachievable because a lot of those photos, those images are filters plus makeup. Makeup artists nowadays can really kind of hide any blemish and things like that. So you have to be very careful nowadays, and also be careful, and also protecting the patient from themselves sometimes because they have some false perceptions based on social media.
Well, and I think that's one of the biggest problems facing people today. We did an episode not in the too distant past on just confidence. And, one of the things that I brought up is something I've thought about a lot, which is every day we wake up, we look in the mirror and we've got socks on our teeth and our breath is horrible and our hair is messed up and we've got, sleep in our eyes. And then we look on social media and everybody looks like $1 million. So we always see ourselves at our worst and we see everybody else at their touched up fake best. And that gives you a fucked up self-image, right? And it seems like that's contributing to your business in a way, which may not be a bad thing, but is that common? I mean, it seems to me that would be the case.
Absolutely, yeah. So I'm seeing younger women coming in for rhinoplasties, nose jobs, as you talked about, Mallory, for sure. They'll show me images of Kim Kardashian, the Kardashian family, and
real.
I have to, right? But I have to guide them, and I have them look in the mirror, and I point out what can be done, what cannot be done. And again, it goes back to the Vectra. So I can use the Vectra again on that 3D imaging and show them what they're going to look like after surgery with almost 100% confidence. So they can tell them, please don't look at social media. This is you. This is how God made you. And this is what's achievable, what I can do in my hands. So it definitely opens their eyes for sure. I remember one patient that came in, she had a little scar on her lip and I could barely see the scar. And so she was flipping through some photos and I thought it was her cousin, but because she had so many filters on the photos, it was actually her. So I was looking at this patient sitting in the seat here, and then I was looking on her camera, on her phone, and it was almost two different people, literally two different people, but because of the filters, it looked like two different people.
Let me tell you how frustrating that is as a swinger, by the way.
Oh, yeah. Meeting people.
Yeah, we're meeting people online, and their pictures are so touched up that you meet them, and you're like, where's that other couple that were in the picture? Because that's not y'all.
And what's fucked up is we still would have went out with them if they just would have showed us their real pictures, but it gives us like this level of inauthentic. I can't talk now. Inauthenticity.
That's okay.
Is that a word?
I'll unfuck it in post, Mallory. It's fine.
You can leave it. I'm human. It's fine.
No, so over time, and I grew up in the National Enquirer generation. It's all my grandmother read, and it seemed like every other issue was somebody's plastic surgery or someone getting repeated plastic surgery. This celebrity's addicted to plastic surgery. And you get, the Donatella Versace's of the world that look like a plastic shoe, right? And of course, if for some reason she listens to this episode, I'm going to get sued.
Joan and Melissa Rivers.
Yeah, Joan and Melissa Rivers, another good example.
Yeah.
So there's all these celebrities that seem to be addicted to plastic surgery. So how many of your patients end up with more than one cosmetic surgery? Does this constant change, like it used to be tits were the thing and now asses are the thing, and now they can put fat from your ass in your tits if you want that? I mean, is social media driving people to come back and get it again and again, or is it that same addiction to change and self-improvement? Do you see that a lot?
I think the continuous self-improvement has always been there in patients, but I think social media has added to that. I think when I see patients initially that dip their toes in the cosmetic world, they'll come in for like Botox or filler, and then on one of the two visits on a follow-up, they'll ask about their eyelids, okay, and then it goes to their face, or then it goes to their body or their tummy. But I would say, in my practice, I would say about 50% people do more than one procedure, and then it goes from there. So then you have the peer pressure too. You have like cousins or sisters or friends that get cosmetic surgery and they like what they have, and so they come in and do that as well. But peer pressure, I think, is really, really strong as well. I think that's always been the case all through human history is peer pressure. But yeah, my patients come back, they definitely have more than one procedure. It starts out small, then they go a little bit bigger. I think it has to do with trust with me. But then you talk about the patients that go super extreme, like the Versace's and the Joan Rivers, where, they'll go out and have one surgery, and then they'll have a second, a third, fourth. But I think what happens is the good plastic surgeons, the safe ones, will kind of stop that from happening. They'll probably say, look, we've done this and this and this. I don't think I can help you anymore. So then that person goes to another plastic surgeon. So they'll do a lot of doctor shopping. Some of those patients that do that, they don't take no for an answer. So they'll go out and find out a doctor that'll actually do that. That's what happened to, Joan Rivers is one. I think Kanye West's mom was like that, I believe, where she doctor shopped and she found after like eight or nine plastic surgeons, she found one that did it, and then what the result was that from. So.
Yeah. Michael Jackson's nose fell off. I mean,
Michael Jackson's nose fell off. There's a story behind that one. Is the original plastic surgeon that did his nose. Remember, he was in the Jackson 5, and I think around the Thriller album, I think he might have had his first rhinoplasty. Mm-hmm. But then thereafter, it got worse with time. The original plastic surgeon that did Michael Jackson's rhinoplasty was at a national meeting, And he purposely went out and told everybody, I've only did Michael Jackson's nose once. I haven't touched it since, because he was worried that, I don't want anybody looking at that nose now and say that I did it.
Yeah, I think I'd want that disclaimer out there too, for sure.
Right. Not my nose.
Yeah, right? Yeah, and that's got to be hard.
Right.
And I think as a woman, we're fighting aging. And like, I've made a decision, like, I want to age gracefully, but I don't want to age quickly either, because we have these examples like fucking Jennifer Aniston and Angelina Jolie, who both look incredible, especially given their ages. So
They're vampires.
I think so I think, that for women, maybe we have this unreasonable expectation. So I'm making a conscious effort to not try and go overboard, because I'm not going to lie, in the last, few months, I've been looking at, my forehead and like my neck and my décolletage, and like I'm having these ideas, and I have to kind of pace myself and go, is this really necessary? Is this what I want? And if I want it now, maybe I should wait, a year or two and see how I feel then. Maybe I won't want it then. Maybe it's my mental state right now.
As a guy, we only have one question. We look down and go, I wish my penis was bigger. I wonder if I could make my penis bigger. Like, literally, that's the only thing guys do. We're like belly, feet, ass, whatever. I want a bigger dick.
Because you know why? Because it's double standard. Because you guys are, as long as you're charming, like, you guys can get away with so much, and you guys get more distinguished as you get older, which I fucking am so jealous of. I can't even tell you. But back to what we were talking about from an ethical perspective, Dr. Blank, what's the line for you as a doctor to say no more? No, I can't do this because of X, Y, and Z. Whether that's frequency or type of the request or additional surgeries, like, what's that line, and how do you have that conversation?
That's a great question. I think it has to do with upfront expectations from the patient. Meaning that patient comes in, they have a concern, and I tell them what to expect and what the outcome can be. And then, if they have additional concerns, additional surgeries that they want to do, and then that raises red flags. See, they have like an issue of like body dysmorphia, where people that are, more mature, 60s and 70s, they're showing me photos from when they're 20. That's a red flag. If you do a facelift on an individual, or they show them like their beach body from, 1965, that's a concern. So those are certain red flags that you're never going to beat Mother Nature for sure. And for the number of surgeries, I lay that all on the line out in front. What do you expect? What's your end game? And I quite frank with the patients too. Mother Nature, I'm not going to beat gravity. I'm not going to beat Mother Nature. Time is always against us, and this is what I can do. So I think it has to do with upfront expectations. I don't promise more than what I can deliver. And I think that's what patients appreciate about coming to my office, is that I'm absolutely frank with them. And at that time, they can decide whether or not they want to have surgery with me or another plastic surgeon. But you certainly have to set boundaries with patients, certainly to protect them from themselves, protect them from their thoughts in their mind of what they want to look like at that age. I can't turn, somebody from 65 or 70 into a 20-year-old body. So it has to do with expectations all the way.
Okay, so if you were not a cosmetic surgeon, would you be an airborne ranger, a male stripper, a gigolo, porn star? What would your career choice have been if you were not a doctor?
I'd probably be an architect. I think it's just cool to design all that stuff.
You kind of did the same thing.
I know, it kind of goes in line with what you're doing now. You're building things.
Building
engineering mindset. Yeah. Yeah. Building houses, building titties.
Building titties.
I was going to say, building titties is probably a lot more fun.
Be a great name for the business. Just change it from, Mid-Florida Plastic Surgery Center to Building Titties.
Yeah.
Or that's
maybe
like
that'll be like my September tagline for a promotion or something.
Yeah.
Like that. That'd be great.
Building titties since 19. No, I'm just kidding.
That's great.
That's great. So do you have a favorite surgery that you perform? Like, whether it's the methods while you're in surgery or the outcomes? Like, do you have a favorite that you get excited about?
I do like the breast augmentations for sure. I think that's my number one. It's a straightforward surgery for me. I love the results because I know the patient helped me to decide and guide like what volume, what implants they wanted. So it makes it easier actually for me. I know in your surgery, Mary, we talked about I'm going to be from this volume to this volume, and you allowed me to have that liberty to choose the final implant volume, which is super helpful. But that makes it so much easier for me as a plastic surgeon to going into the surgery knowing that the patient chose the volume, and it's just kind of a mental ease to going into surgery. It's a fun surgery. I know the people in the OR love it because everybody, the patient sits up and then we all choose the volume. And so it's kind of like a pageant, but the patient doesn't know what's going on. But then, and everybody has their own say. But no, that's the fun surgery. And then I think my second one would be rhinoplasty would be my second favorite surgery. But definitely breast augmentations are my favorite.
I love it. And I can't blame you. Like, if my job could be look at boobs every day, all day, I would absolutely sign up for that job. You need someone in the OR voting on the implant size. I'm totally there. If that's my only job. You don't want me touching anything.
You can set up a panel.
Yeah,
you just be behind the glass window and hold up like little key cards.
Yeah,
These are a 10.
Yes, exactly.
That's right.
Actually, I got to say, Doc, that there's something about your demeanor, and I hope that our listeners today have seen a little bit of that demeanor from you that really kind of ingratiated trust with us for you. And without that trust, Mallory wouldn't have looked at you and said, do what you think is best. Like, it'll be somewhere in this range, because I know in her head, she was very worried about having volleyball titties, right? Having these hard, bulbous orbs hanging off her chest. But at the same time, as an experienced professional and as a titty architect, you actually knew that they probably were going to need to be a little bigger than she thought they should be. And so you were able to make that decision because we trusted you. And what came out of it were these two Titanic fun bags that I love playing with all the time, and they're awesome.
Yeah, I love them. They're actually perfect. And I'm really glad that, we had that conversation, that you chose the route you did, because at the end of the day, you're the professional. You knew better, and anyone that sets that hard and fast rule, I think they're maybe missing the mark a little bit, because you want to have the best result possible. And if you had handed me the implant size that I actually have, I probably would have ran out the door at first and be like, these are the only ones you need. But again, we had the conversation around it, and they look amazing. I love them so much. Like, was it 3 months post-op? I literally was like, I just want to show everyone my naked boobs.
Well, yeah, and you did. I mean, there were a lot of pictures flying around, but I think, a lot of the other doctors we went to, it was very much like, this is, okay, here's your size, this is what we're going to do.
Yeah.
And because, we went to the Monet of Mammaries, then, he was able to just do his work and bam.
Yeah, they're great.
There you go. That's your new name, Dr. Plank. You're the Monet of Mammaries. Better than
I love that.
Picasso of pecs, because Picasso was all abstract and titties on the shoulder, and it just wouldn't have been right.
That would not be an apt description, and please don't do that.
No. Definitely
no,
Monet.
definitely
Beautiful landscape of titties. Anyway, Dr. Plank, do us a favor. Tell us, how can patients find you? Can you do remote consultations? What's your website? What's your Instagram? Let's point some people at you to have this conversation, because I would love for some of our listeners to have the same positive experience that we had. And by the way, folks, we didn't get a dime off of this surgery for doing this. We're doing this for Dr. Plank because we had such a great experience. So just, this is not paid. This is something that we really loved. Doc, tell people how to find you.
Mickey and Mallory, thank you so much for having me. It's been a blast. I've been thankful and grateful that you chose me as a plastic surgeon to help you improve your life, Mallory. It's been such a great journey. My website is Dr. David Plank, drdavidplank.com. That's my website. And my Instagram is the same, Dr. David Plank or Instagram at Dr. David Plank. That's my Instagram.
Awesome.
And my office number is 407-960-6936.
Got it. And you need to go out and get 1-800-DEM-TITTIES, because that would be awesome.
I love it.
Yeah, right. Well, this has been an honor, and it's actually been an absolute fantastic experience from day one working with you, Doc. So thank you very much for pretty much everything about how you approach this business. I'm saying that as the guy that gets to play with her titties. I know Mallory has her own opinions, but it's been great.
It's been wonderful. Thank you so much for my titties
Thank
and
you
this
for having
conversation.
Mallory, well, let's dip out of here and let the good doctor go on his way, because I'm sure he's got something else fun to do today. You want to remind everybody how to find us, and then we'll be back in a hot second with Whiskey of the Month for May.
So we are Casual Swinger everywhere. That's casualswinger.com. You can reach us at podcast@casualswinger.com if you'd like to shoot us a message. We are on social media. That's Twitter, Facebook, YouTube, and Instagram, as well as the dating sites if you want to check us out on SLS, STC, Cassidy, or Double Date Nation.
And there it is, folks. This has been the best episode ever with Dr. David Plank. We'll be back in a hot second with some of that whiskey you guys know you can't get enough of. You've been listening to Casual Swinger. And we're back with Casual Swinger. My name is still Mickey.
And I'm Mallory, and I'm excited.
It is time for another Whiskey of the Month. I feel like we do these like every other episode.
I think we do, but we have a lot of whiskeys that we drink.
There's a lot of friggin' whiskey in this bar, so we have a lot of whiskey to talk about. Before we get started with Whiskey of the Month, Starry, how do you feel about whiskey?
Candy is dandy, but whiskey makes you frisky.
Oh, that's right. The Whiskey of the Month for May 2022, the year of our Lord, or whatever you want to call it, is Michter's US 1 Rye Whiskey.
Yum. This is definitely a staple in our bar. We've been drinking Michter's for quite a few years now, and it turns out they have an incredible story.
They really do. And, you know, sometimes even I don't necessarily know how storied some of the whiskeys are in our bar.
Yeah, fair enough.
Yeah, and some of them are absolutely crazy. A good example would be Horse Soldier, which was last month's Whiskey of the Month.
That was a good one.
You know, by the way, I'd never actually watched that movie, 12 Strong. I was on a plane this week, and I actually watched it. I was
good
like,
for
"That's a pretty
you.
good fucking
I was
movie."
going to say, it was a phenomenal book, too.
Yeah, I usually don't watch movies after I've been through the book just because I don't want to let them ruin it for me. Whatever,
That's fair.
Anyway, this month is Michter's US 1 Rye Whiskey. So let's start with a little bit of the Michter story, and Mallory and I will kind of trade off a little bit on this because it is a bit of a long story, which is to be expected.
Yeah, this one's a little long, a little sordid. You know, it just shows that the brand had some tenacity and just some fate associated with it to make it to today.
Well, this particular whiskey dates back to 1753.
Which is
pre-America.
Yeah.
I mean, it's pre-America.
Yeah.
I mean, this is a brand that goes all the way back.
It was a colonial whiskey.
It was. So originally known as Shanks and later as Baumburgers, the whiskey company, which ultimately became known as Michter's, was founded by John Schenk, a Swiss Mennonite farmer in Schaefferstown, Pennsylvania in 1753. In their earliest days, Schenks produced whiskey from rye grain, a favorite local crop in Pennsylvania Blue Mountain Valleys, where this particular distillery was located.
Yeah, according to Pennsylvania historical lore and commemorated by the Lebanon Valley Coin Club in 1978, this particular rye whiskey was so valued that when the Revolutionary War broke out, General George Washington, yeah, I said that right, General George Washington.
The guy.
The
dollar bill.
Visited the distillery and purchased whiskey to fortify his men as they hunkered down in their camps through the long, brutal winter at Valley Forge. Over 200 years later, the Michter's Pennsylvania management would say Michter's was the whiskey that warmed the American Revolution.
What a huge piece of information that is. First of all, Valley Forge is, I mean, that was kind of the turning point in the Revolutionary War. If they could survive the winter, they could fight.
Yeah.
What a huge, huge deal that was. And more importantly, General Washington went to this distillery to acquire whiskey to help keep his men warm during this brutal winter. Now, of course, what we've come to learn since then is that whiskey doesn't actually warm you up. It just makes you think you are. So they probably suffered from a lot of frostbite and a lot of bullshit issues.
Probably, but they felt better about it.
Yeah, they were much happier. They were at least fucking hammered while they did it. But so in the mid-1800s, Pennsylvania Dutchman Abraham Baumburger purchased the distillery, and it became known for many decades as Baumburger's whiskey.
Yeah, the passage of Prohibition in 1919 did force the distillery, along with other American spirit producers, to shut its doors to the public. Although the distillery did reopen after the repeal of Prohibition, it changed hands many times over the next few decades and frequently occupied a precarious position financially. During the 1950s, Lou Foreman, one of the distillery's then owners, created the modern Michter's brand name, so it came to this name by combining portions of his son's names, Michael and Peter.
So the name Michter's is actually, it's just kind of a slam together of Michael and Peter.
Who'd have thunk?
No one would ever know that. But in 1989, with the entire American whiskey industry suffering a prolonged downturn, that's right, in the 80s, nobody wanted whiskey. Michter's then owners declared bankruptcy and abandoned their premises, leaving their Pennsylvania operations in complete disrepair, Michter's name seemingly lost to history. Were it not for a fortuitous connection to two whiskey lovers with an abiding admiration for the old Michter's legacy and quality.
So in the 90s, Joseph J. Magliocco and his consultant and mentor, Richard, quote-unquote, Dick Newman, teamed up to resurrect Michter's. Magliocco, who entered the wine and spirits industry after attending Yale College and graduating from Harvard Law School, was intimately familiar with Michter's through his college days of imbibing, bartending, and selling Michter's.
That's right. He was a drunk who went to Yale and Harvard.
He was a smart drunk.
But Newman, he followed up his service in the United States Marine Corps, for which, by the way, he earned a Purple Heart, so there's a bit of a theme to some of these brands that we offer. Or maybe it's just that first responders and soldiers like booze. Not sure which. Anyway, we'll come back to that some other time. His illustrious career in the whiskey business followed his military service, eventually running Old Grandad, Old Crow, and Old Taylor for national distributors before becoming president and CEO of Austin Nichols. Austin Nichols is the distiller of Wild Turkey.
That's fucking cool. I didn't know that. So Magliocco and Newman began with a simple strategy to honor Michter's legacy by producing the best whiskey possible, cost be damned. After filing for the unused and abandoned Michter's trademark, they made their first major strategic decision to resurrect Michter's in Kentucky, in the heart of the modern American whiskey industry, to ensure access to the best whiskey talent and resources available.
Today, Michter's has 3 locations in Kentucky, a 78,000 square foot distillery in the Shively section of Louisville, the architecturally significant Fort Nelson building on Louisville's Museum Row, and over 200 acres of farmland in Springfield, Kentucky.
So what makes Michter's special? What's so special about this bottle? I think the first point is going to be cooperage, right? The wooden barrel making.
That is literally a cooper makes wooden barrels. That's what a cooper does.
Yeah. I didn't know that had a name.
Yeah, and
How
so
fucking cool.
Yeah, that's special.
So Michter specifies wood that has been thoroughly and properly dried, sometimes for as long as 18 to 48 months, in order to enhance this natural properties of the wood, and it'll allow, better flavor, and it reduces the level of tannin imparted to the whiskey, because tannin, doesn't it give it that bitter,
a little bit,
harsh taste to it?
Yeah,
okay,
a little bit. It's something. We're talking about this, by the way. We got a couple more little pieces here. Michter says, "Cost be damned." That means they don't give a shit what it costs, kind of like the whole John Hammond in Jurassic Park, spare no expense, right? Mm-hmm. They make the best whiskey they can make, period. And so a good example of that is the toasting and the charring process. To toast a barrel before charring it helps to make the wood sugars more accessible. These sugars caramelize and concentrate to form the red line in the barrel stave cross-sections due to the heat, ultimately adding more flavor and more color to the whiskey as it seeps through the char to the caramel red line.
Awesome. Another point to make about this one is the low entry proof, which is I found very interesting. Although the typical industry entry proof is about 125, Michter's believes that the lower at 103, which is 51.5 alcohol by volume, which is historically regarded as the gold standard in Kentucky, allows for concentrated sugars of the toasted and charred wood to dissolve more rapidly into the distillate as it cycles in and out of the barrel. So even though the lower entry proof yields fewer bottles per barrel, Michter's believes that the smooth flavor and richer mouthfeel makes it worth it.
Right. And I'll tell you another thing they do, and this is another where cost be damned, right? Because this hurts them badly. They do something called heat cycling a barrel. This is another way that they make less whiskey, but better whiskey. Right?
Interesting. Okay.
Well, so what heat cycling is, the more often that whiskey expands and contracts, cycles, if you will. soaking in and then back out of the wood of the barrel, the more flavor it absorbs from the sugars in the caramelized red section of the wood. Heat cycling is an uncommon practice, and I'm going to tell you why in a hot second, but it's used to raise and lower the temperatures in the barrel warehouses to induce extra cycles within a given year. This practice is very costly because heat cycling significantly increases the angel's share evaporation during aging, but in most cases, very much enhances the flavor of the whiskey. If you remember the whiskey of the month from a few months ago, Angel's Envy, it was actually named after the phrase, the angel's share. So as whiskey ages, some of it evaporates. The whiskey that evaporates, which is as much as 30% of the barrel in a given aging cycle, is known as the angel's share, which means the angels drank your shit.
It's cool that they do that, and even though it's costly, obviously, but that concentrated Michter's does have a really great profile to it, which we'll get into in a minute. They do another process that they call chill filtering, which I wasn't too familiar with. So Michter's chill filters all of their whiskeys instead of using carbon filtration that can strip out flavor and aroma because they want to keep that profile very pure. Moreover, rather than use the one-size-fits-all approach that many distilleries do, they use filtration mediums and technique best suited to each individual whiskey offering because they have multiple offerings in their line. Despite it being time-consuming and costly, this allows them to highlight each expression and accent the best qualities of each.
Yeah, I think that's just so cool. There's so much that goes into a bottle of Michter's whiskey, and they have a lot of different expressions, right? It's not just US 1. There's a bunch of other ones. I think we've got 5 or 6 of them in our bar, and they're all very unique.
They're all very unique, and they're one of the few brands that I can point at, aside from Whistlepig, that I've enjoyed every example of.
Yeah, and there's a few that you're still to look at because they were so expensive.
Yeah, there's a dust on a bottle up there for sure.
But hey, about Michter's US 1 rye, the nose, it's warm, it's inviting, kind of like your grandma's house in the holidays. I feel like we should have like a little special background music for that.
I love that.
Immediate nose is a bit of lavender, roasted corn and grain after a nice long draw from the bottle. Fruit notes follow, cinnamon, plum, a few other things. I don't know, it's a little fruity after that first long note. And of course, a touch of maple sugar follows with a little bit of old leather and a little bit of barrel char.
It does smell very delicious. It's one of the whiskeys I like sniffing the cork, which I know you're not really supposed to do. That's a wine drinker's thing, and I'm no sommelier, but it does smell very, very nice. On the palate, it's described as being dry, warm, not too spicy, more black pepper than anything else. Rye, followed by a rye toast with maybe molasses, burnt sugar, so you get a little bit of that warm char taste to it, but a little sweetness. It's definitely a bit woody forward, but it's not a bad thing. I mean, because these are finished in charred barrels, so you want some of that wood. That's what helps give it its depth and profile.
Yeah, so just a couple of final thoughts on Michter's US 1 rye whiskey. This whiskey is from a brand as old as this country. It's older than this country.
It survived all the machinations, right?
Yes. It's basically just a phenomenal example of what good whiskey can taste like without breaking the bank. Try other expressions from these guys, even from the US 1 line, like the American whiskey or the bourbon. Both are within the price range we set for Whiskey of the Month, and they're excellent expressions themselves of what a good, affordable whiskey can be.
Yeah, these are outstanding in mixed drinks like an old-fashioned or a Manhattan or a whiskey sour.
Yeah, very much so. And, of course, they're cheap enough to be a daily drinker for those who are predisposed to doing so. Me.
Hands up in the air.
That's right. Guilty as charged.
All right, guys. I think that's it for us. I got a fucking pack for PCAP. I think our next episode is going to be a live episode from Palm Springs.
Hot damn.
What the fuck?
It's going to be fun.
It'll be
and
great.
Hey, we got a whole new board, so hopefully that one will let us record on the road without making a mess out of the audio like our last episode. Sorry about that, guys.
Yeah, that'll be a good time. But hey, we'll see what happens.
All right, guys. Well, since Mallory told you guys how to find us during the last segment, we're going to leave that off at the end here and just say we'll see you in a couple of weeks live from PCAP. This has been a blast. Mallory, you want to say bye to everybody?
Bye, everybody. I'm going to go get my freak on.
Hot diggity damn. You've been listening to Casual Swinger.